Are you tired of the sneezing, congestion, and discomfort caused by the common cold? Are you seeking effective relief for your symptoms? In this comprehensive video, we unveil the most powerful alternative treatments and remedies to tackle the common cold head-on. Let's start by defining the common cold and how it's transmitted. The common cold is a viral infection that primarily affects the upper respiratory system. It's caused by various strains of viruses, with the rhinovirus being the most common culprit. When an infected person coughs, sneezes, or talks, tiny respiratory droplets can land on surfaces where they can be touched by someone else, and then introduced to that same individual's mucous membranes if they touch their eyes, nose, or mouth. Additionally, after a cough or sneeze, airborne droplets can be inhaled by others nearby, leading to new infections. And since infected mucus from a runny nose can transmit colds, it's essential to practice good hygiene, like washing your hands, especially after blowing your nose. When you cough or sneeze, you should cover your mouth and nose with either a tissue or the inside of your elbow, rather than coughing and sneezing into the open air or into your hands. This is because if you use your hands to cover your mouth and nose when you cough or sneeze, infected respiratory droplets will transfer onto your hands. Subsequently, when you touch surfaces like doorknobs, elevator buttons, or handrails, you will deposit these germs, creating a potential transmission hotspot for others. And now you may be wondering, what's the best way to prevent or treat the common cold? Let's explore a few alternative and over-the-counter treatments. Number 1. Garlic. Garlic has been traditionally considered a remedy for the common cold due to its potential immune-boosting properties. Allicin, a compound found in garlic, is believed to contribute to its antimicrobial and antiviral effects. Some studies suggest that consuming garlic could potentially help reduce the severity and duration of cold symptoms. While research in this area is ongoing, garlic's reputation as a natural remedy for colds is rooted in its long history of traditional use and its association with immune system support. There are various ways to consume garlic, each offering its unique benefits and culinary possibilities. One of the simplest methods is to finely mince or crush fresh garlic cloves and add them to your dishes, such as in sauces, dressings, or marinades, for a potent burst of flavor and health benefits. Alternatively, you can slice garlic thinly and use it as a garnish on salads or roasted vegetables. For those who prefer a more convenient option, garlic pills are available in health food stores, pharmacies, and online retailers. These supplements provide the potential health benefits of garlic in a convenient form, making it easier to incorporate into your daily routine. Number 2. Turmeric. Turmeric's active compound, Curcumin, is known for its anti-inflammatory and immune-modulating properties. There is a link in the description of this video that investigates the effects of curcumin-rich formulation in reducing the severity and duration of common cold symptoms. Results suggest that the turmeric remedy shows promise in alleviating symptoms and improving overall well-being among participants with the common cold, highlighting its potential as a natural and alternative approach for managing cold-related discomfort. One of the ways to consume turmeric is to grate or finely chop fresh turmeric root and add it to your dishes, such as in curries, soups, or stir-fries. Alternatively, you can brew turmeric tea by steeping grated or ground turmeric in hot water, often mixed with other spices like ginger and black pepper for enhanced flavor and absorption of curcumin, which is again the active compound in turmeric. For those who prefer a more convenient option, supplements make it easier to incorporate turmeric into your daily routine. Number 3. Zinc. While there is no definitive assurance that zinc supplements effectively prevents colds, research suggests that zinc may potentially have a modest impact on reducing the duration of colds. Some research suggests that zinc lozenges or nasal sprays might lead to symptom relief. Zinc can be consumed through various methods, with dietary sources being the most natural and preferred way. Incorporating zinc-rich foods like lean meats, seafood, dairy products, legumes, nuts, and whole grains into your diet is an excellent way to ensure adequate intake. However, when dietary sources are inconvenient or insufficient, zinc supplements are a good alternative. Number 4. Vitamin C. While vitamin C is commonly associated with immune system support, scientific evidence regarding its effectiveness in preventing or treating colds is inconclusive. However, some studies suggest that regular vitamin C intake may slightly reduce the duration and severity of cold symptoms, especially with certain populations, such as with athletes and individuals exposed to extreme physical stress. Studies indicate vitamin C's impact on cold prevention varies among individuals. Vitamin C can be incorporated into your daily routine through various methods, with dietary sources being the most natural and preferred way. Including vitamin C-rich foods like citrus fruits, strawberries, kiwi, bell peppers, and broccoli in your diet is an excellent way to ensure adequate intake. However, when dietary sources fall short, vitamin C supplements are widely available and should be considered as a suitable option. Number 5. Apple cider vinegar. There is limited scientific evidence showing that apple cider vinegar's acidic nature, due to compounds like acetic acid, can help break down mucus and provide relief from cold symptoms. Apple cider vinegar has gained popularity for its potential health benefits, including antimicrobial properties and immune system support. It is said to have an acidifying effect on the body, which speeds up the activity of white blood cells, wherein they eliminate harmful microorganisms. While apple cider vinegar might offer some relief, it's important to dilute it and use it in moderation due to its high acidity and potential damage to tooth enamel. Number 6. Intermittent fasting. Research suggests that periods of fasting may trigger a beneficial response from the immune system, promoting the activation of immune cells and the clearance of pathogens. Periods of fasting can lead to a reduction in certain immune system cells, which in turn triggers stem cells to generate new immune cells. This process rejuvenates the immune system and enhances its ability to combat infections. While the study primarily focuses on bacterial infections, the findings imply intermittent fasting could potentially enhance the body's ability to fight off other infections, including the common cold. Number 7. Reducing stress, which contributes to better health, may prevent respiratory infections like colds. In a 2012 National Center for Complementary and Integrative Health funded study, linked in the description, persons aged 50 or older were randomly allocated to mindfulness meditation, which reduces mental stress, fitness training, which enhances physical health, or a control group that received no intervention. Participants tracked their ailments throughout cold and flu season. The meditation group experienced shorter and milder acute respiratory infections and missed fewer workdays than the control group. Meditation appeared to provide more benefits than those that were obtained through physical exercise. Number 8. Getting proper sleep. Sufficient sleep is a potential strategy to prevent the onset of the common cold. A lack of sleep can weaken the immune system, making the body more susceptible to infections like the cold. Adequate sleep is a vital factor in maintaining a strong immune response and reducing the risk of getting sick. While sleep alone may not guarantee complete immunity from the common cold, it plays a significant role in supporting the body's overall health and immune function, thus contributing to the prevention of cold-related illnesses. Number 9. Ginger. Ginger's anti-inflammatory components work on inflammation throughout the body, but they do particularly well in the nasal passages and sinuses. That's because it has antibacterial and anti-inflammatory compounds called sesquiterpenes, which target rhinoviruses directly. Including ginger-rich elements like fresh ginger root, ginger tea, and ginger-based sauces in your meals is an effective way to ensure sufficient consumption. Nevertheless, if dietary sources prove inadequate, ginger supplements are readily accessible at most local drugstores. Number 10. Glutathione supplementation has gained attention for its potential benefits in alleviating symptoms of the common cold. As an essential antioxidant produced naturally in the body, glutathione plays a vital role in supporting the immune system and protecting against oxidative stress. Some studies suggest that boosting glutathione levels through supplementation may help bolster the body's immune response, potentially reducing the severity and duration of cold symptoms. Glutathione can be obtained through dietary sources such as fruits, vegetables, and lean proteins. But for targeted supplementation, it's advisable to consult a healthcare professional who can recommend appropriate dosage and delivery methods, such as via oral supplements or intravenous administration to ensure optimal results and safety. Unfortunately, since antibiotics are primarily prescribed for bacterial infections, they are not the most effective means at treating the common cold initially, since the common cold is caused by viruses and not by bacteria. Therefore, the best approach toward treatment is to focus on preventing and managing the symptoms. Getting rest, staying hydrated, and using over-the-counter medications like decongestants or pain relievers can also provide relief. And always consult a healthcare professional before trying any treatments or making significant health changes. Individualized advice based on your medical history and conditions is essential for optimal results. If your symptoms persist or worsen, if you have a high fever, difficulty breathing, or chest pain, it's essential to seek emergency medical care promptly. Please be sure to check out the description field of this video for additional resources. Liking this video and subscribing helps get this valuable information in front of more people who may need it. Thank you for watching and sharing.